Hello, this is Jeong from Jeju National University, College of Veterinary Medicine. I will announce on day one competency from providing veterinary service. I will announce this order. The objective of this presentation is understanding day one competencies to be equipped after graduation. College graduates should be equipped with skills that society needs. Educational object at the national level is to train competent veterinarian with ability to treat a patient independently. The aim of education is for all graduates to achieve day one competencies regardless of whether his career is to be clinical veterinarian. Day one competency is the ability to provide veterinary services upon graduation, and it is the goal of veterinary education. Competencies contain not merely to know but also can do. Furthermore, competencies include hands-on practice, differentiating from understanding and memorizing with our head. But students, even professors, do not know the graduate day one competencies. This can be called a crisis of the university. It is the only country that do not train clinical skills of day one competencies and assesses clinical skills at a national exam. Without the day one competencies, graduates cannot do anything of expertise in society. Therefore, students must know about day one competencies and be equipped with the competency upon graduation. Day one competencies consist of 7 items. I will describe each item. First thing is diagnosis of disease. Clinical pathology in small animals. The course is we should be able to determine the state of health of patients through each detail of the blood test and to identify the reason for the change in the blood test and be equipped with analytical skills. The objective of this presentation is understanding day one competencies to be equipped after graduation. Next is anesthesia and pain management. First, anesthesia. Specifically, there is an inhalation anesthesia in small animals. We should be aware of the principles of inhalation anesthesia and conduct inhalation anesthesia to small animal patients and monitor the condition of the patient during inhalation anesthetic and treat appropriately. Next, pain management. We should be aware of mechanisms by which pain occurs and identify the type and degree of pain from small animals and should be capable of reducing pain with administering the analgesic and local anesthetic according to the pain. Next is basic skills of internal medicine. First, blood collection in small animals. We should be able to choose the appropriate blood vessel according to the species and condition of the animal, and collect blood from the jugular vein and cephalic vein. And we can select a suitable anticoagulant depending on the checklist. Next, physical examination in small animals. We should determine the state of the patient through ocular inspection, palpation, auscultation, and nose, and identify inspection tests according to body parts. With ocular inspection, we can examine eyeball, eyelid, external ear canal, skin or cavity, working, standing position, evacuation or urination state. And palpation, we can examine superficial lymph node, joints, palpable organ within the abdominal cavity, dehydration. With auscultation, we can examine lung and heart. Next, ovarian hysterectomy in small animals. We should be aware of appropriate anesthesia and sutures for surgery, and determine the degree of respiration anesthesia state of the subject, and indicate the anatomical location and perform proper surgery. The objective of this presentation is understanding Day 1 competencies to be equipped after graduation. And finally, prevention of disease and infectious disease, specifically disinfection and disinfectants. We should be aware of the types of disinfectants and disinfection and prevent infecting patient and from patient. And we should be able to select a disinfectant that is appropriate for the situation and can use disinfectants correctly. Hello, this is Jeong Lee from Jeju National University.